Hello, and welcome. Today we're taking an important step together toward understanding your health and well-being. We're diving into vasculitis, a condition where your blood vessels, the highways of your body, become inflamed and narrowed, making it harder for blood to travel where it's needed most. Imagine traffic jams in your body's supply routes. That's what happens when vasculitis strikes. Just like a city gridlock, this can slow down or even stop the delivery of vital nutrients and oxygen to your organs and tissues. This inflammation can restrict or even block blood flow, leading to serious health issues such as organ damage, pain, or fatigue. The effects can be sudden or develop over time, making it crucial to pay attention to your body's signals. Vasculitis doesn't discriminate. It can affect anyone, at any age, and can impact any organ in your body, from your skin to your heart, lungs, or kidneys. Early awareness is your best defense. Learning about the warning signs and understanding your risk factors can help you stay ahead of potential problems. Recognizing symptoms and seeking help quickly can make all the difference. Don't hesitate to reach out to a healthcare professional if you notice anything unusual. In this chapter, we'll break down what vasculitis is, what causes it, and how it's managed. We'll also discuss the latest treatments and lifestyle tips for living well with this condition. With early detection and proper care, people with vasculitis can lead full, active lives, enjoying time with family, friends, and doing the things they love. Our goal is to give you clear, practical information so you can be proactive about your health and support those you care about. By the end, you'll know the signs, understand the risks, and feel empowered to take action, whether for yourself or a loved one. Let's get started and learn how to protect yourself and your loved ones from the effects of vasculitis together. Remember, knowledge is power. Let's use it to make informed choices and build a healthier future. Vasculitis is a medical term that means inflammation of your blood vessels, arteries, veins, and capillaries. These vessels are the essential highways that carry blood throughout your body, delivering oxygen and nutrients to every organ and tissue. When these vessels become inflamed, their walls can thicken, weaken, or even scar. This disrupts normal blood flow, much like a kinked garden hose slows or blocks water. The result is that organs and tissues may not get the blood supply they need to function properly. Vasculitis isn't just one disease. It's actually a group of rare disorders, each with its own causes and symptoms. Doctors classify vasculitis based on the size of the blood vessels affected: large, medium, or small. Large vessel vasculitis targets major arteries, such as those leading from the heart, and can affect blood flow to big organs like the brain or limbs. Medium vessel vasculitis impacts arteries that supply organs like the kidneys or intestines, while small vessel vasculitis involves the tiniest blood vessels, capillaries, that reach into the skin, nerves, and other tissues. The type of vasculitis you have determines which organs are at risk and what symptoms you might experience. Some forms are mild, while others can be severe or even life-threatening. Because blood vessels are found everywhere in the body, vasculitis can potentially impact any organ system, from your skin and joints to your heart, lungs, kidneys, or brain. For example, if the blood vessels in your kidneys become inflamed, it can lead to kidney problems, affecting how your body filters waste. In the skin, vasculitis often causes rashes, red or purple spots, or even painful sores that don't heal easily. If blood vessels in the brain are affected, it can result in neurological symptoms, such as headaches, confusion, or even strokes. Sometimes inflammation causes vessel walls to bulge out, forming an aneurysm, or to close off completely, known as an occlusion. Both situations are dangerous and require urgent medical attention. These complications highlight why early diagnosis and treatment are so important. The sooner vasculitis is identified, the better the chances of preventing serious damage. Vasculitis can be life-threatening if ignored, but with prompt medical care and the right treatment plan, many people are able to manage their symptoms and lead full lives. Understanding the basics of vasculitis helps you recognize when something's wrong and empowers you to seek help early. Next, let's explore what causes vasculitis and how it develops in the body. Why does vasculitis develop? Most often it's an autoimmune disorder. Your immune system mistakenly attacks your blood vessels. The exact cause is usually unknown, but genetics can increase your risk. Environmental triggers, like infections, may set off the disease in those who are susceptible. Chronic infections such as hepatitis B or C are linked to some types of vasculitis. Other risk factors include certain blood cancers, autoimmune diseases like lupus or rheumatoid arthritis, and rarely, specific medications. It's a complex interplay of genes, environment, and immune response. Remember, having risk factors doesn't mean you'll get vasculitis, it just raises your chances. Most people with these risks never develop the disease. Understanding these triggers helps doctors tailor prevention and treatment. Next, let's talk about the symptoms you should watch for. Early recognition is key. Vasculitis symptoms can be confusing. They often mimic common illnesses, making it difficult to know when something more serious is happening. Many people initially mistake these signs for a lingering cold, the flu, or even stress, which can delay getting the right help. General symptoms include persistent fever, unexplained weight loss, fatigue, and muscle or joint aches that don't improve, even with rest or over-the-counter medicine. You might notice you're more tired than usual, or that you're losing weight without trying. Unlike the flu, these symptoms linger and often get worse over time, sometimes lasting for weeks or even months. This ongoing discomfort can be frustrating and may interfere with your daily life. Night sweats and loss of appetite are also common, making it harder to get restful sleep or maintain your usual eating habits. Specific symptoms depend on which organs are affected. For example, you might see skin rashes, purple or red spots, or sores that don't heal as expected. Chronic sinus infections or frequent nosebleeds can also be a sign, especially if they keep coming back or don't respond to usual treatments. Shortness of breath, chest pain, or coughing up blood may indicate that your lungs are involved, which can be serious and needs prompt attention. You might also experience numbness, tingling, or weakness in your hands and feet, which can make everyday tasks more difficult. Kidney involvement may cause dark urine, swelling in your legs, or high blood pressure, often without early warning signs, so it's important to pay attention to these changes. Severe headaches, confusion, or abdominal pain after eating can signal involvement of the brain or intestines, and should never be ignored. Because symptoms are so varied and can change over time, keeping a detailed log of what you're experiencing helps your doctor make an accurate diagnosis and track your progress. Don't ignore persistent, unexplained symptoms. Early detection and treatment can make a big difference in your outcome. Next, let's see how doctors confirm vasculitis and what steps are involved in getting a clear diagnosis. Diagnosing vasculitis is like solving a puzzle. Symptoms are varied and can mimic other diseases. It starts with a thorough medical history and physical exam, looking for signs like rashes or nerve changes. Blood tests check for inflammation, ESR, CRP, and anemia. Specific antibody tests like ANCA can point to certain types of vasculitis. Urine tests help detect kidney involvement. Imaging, CT, MRI, or angiograms, shows which vessels are affected. The gold standard is a biopsy, a small tissue sample examined for vessel inflammation. Only a biopsy can confirm vasculitis for sure. Accurate diagnosis is crucial for starting the right treatment. Early detection leads to better outcomes. Now, let's explore how vasculitis is managed. The main goal in treating vasculitis is to control inflammation fast and prevent organ damage. Treatment has two phases: inducing remission, stopping inflammation, and maintaining remission, keeping disease inactive. Corticosteroids like prednisone are the first line, but long-term use is minimized due to side effects. Severe cases may require stronger immunosuppressants like cyclophosphamide or rituximab. Maintenance therapy uses milder drugs such as methotrexate or azathioprine. Regular doctor visits are essential to monitor side effects and disease activity. Healthy habits, balanced diet, gentle exercise, stress management, and rest support recovery. Avoid smoking and manage other health risks. Taking an active role in your care improves outcomes. Let's talk about prevention and proactive steps. Can vasculitis be prevented? For most types, no. Causes are largely unknown and unpreventable. Focus shifts to risk reduction and early detection. Vaccination against hepatitis B and avoiding risky behaviors can lower risk for some forms. If you develop unusual symptoms after starting a new medication, contact your doctor immediately. Healthy lifestyle choices, no smoking, balanced diet, regular activity, support your immune system and vascular health. Early detection is your best defense. Don't ignore persistent fatigue, fever, or rashes. Know the warning signs and act quickly. Being proactive means better outcomes and less organ damage. Stay informed and listen to your body. Next, let's highlight the critical warning signs you should never ignore. Some symptoms demand immediate medical attention. Persistent fever, unexplained weight loss, and overwhelming fatigue together are red flags. Sudden vision changes or loss, severe headaches with scalp tenderness or stroke-like symptoms, numbness, weakness, trouble speaking are emergencies. New or worsening shortness of breath, coughing up blood, or chest pain could mean lung involvement. Skin rashes with purple or red dots or non-healing sores, especially with other symptoms, need urgent evaluation. Severe abdominal pain after eating or blood and urine stool are also warning signs. Trust your instincts. If something feels seriously wrong, seek help. Early intervention saves lives and prevents permanent damage. Don't wait for symptoms to resolve on their own. Awareness and quick action are your best protection. To wrap up, vasculitis is a complex but manageable condition when caught early. It's caused by immune system misfires, can affect any organ, and presents with a wide range of symptoms. Early recognition and diagnosis are crucial for effective treatment and a good quality of life. Modern therapies can control inflammation and help people return to normal activities. Your best tools are awareness, healthy habits, and open communication with your doctor. Track your symptoms, act on warning signs, and don't hesitate to seek help. Prevention isn't always possible, but early action is. Stay proactive, informed, and engaged in your health. Remember, you are your own best advocate. Thank you for joining us. Stay well and stay aware. Knowledge truly is your strongest ally.